human rights defender is Jericho Paterno. His participation today is made more significant because we are observing today World AIDS Day. So let me tell you a little bit about Jericho. On December 27, 2005, Jericho found out that he was HIV positive. The timing couldn't have been more unfortunate. It was his birthday. He had just turned 29 years old. Jericho was in Dubai at the time. He had been working there for a few months as a waiter. One day, his employer asked him to take a mandatory HIV antibody test, a routine exam for overseas Filipino workers in Dubai. The test was repeated several times, but they offered no explanation to Jericho. After repeated testing, he was just confined in the hospital's isolation ward. He was not informed what was wrong with him, and he was barred from leaving the hospital or from seeing anyone. 3 weeks of anxious waiting went by, after which he was told, just matter-of-factly, that he was HIV positive. He was immediately deported by the Dubai authorities. He was not even given enough time to pack his things or to collect his last paycheck. He was driven out of Dubai, literally with just the shirt on his back. This was Jericho's first taste of discrimination as a result of being HIV positive. While it was terrible enough, it was nothing compared to the ordeal that he imagined was waiting for him back home. To Jericho's great relief, his father took the news quite calmly. His father assured him that nothing, not even his condition or how he contracted the infection, would change the way he felt about his son. Despite his father's acceptance, Jericho found himself in a very dark place from which he thought there was no way out. For 2 years, he refused to work. He shut himself off from the world and did not see anybody. He started to lose weight. He was sick all the time. He wanted to see a doctor, but he didn't know exactly which doctor to go to. The year was 2007. We would imagine that by that time, people with HIV infection would have sufficient information about treatment facilities. Jericho researched his condition online, but he couldn't find information on which local groups could help him. It was only when he was stricken with pneumonia that his father finally persuaded him to check himself into San Lazaro Hospital. While in San Lazaro, Jericho met representatives of Pinoy Plus, a care and support group for persons living with HIV/AIDS, who were able to explain to him what HIV infection was and how it could be managed. They helped him to realize that with proper care, he would be able to buy more time. Jericho has been HIV positive for 6 years now. He religiously takes antiretroviral drugs, as a result of which he's strong and healthy. Not exactly the mental picture most of us have of people that are HIV positive. Jericho now works as an area coordinator of Pinoy Plus. He's a source of encouragement for people who have recently discovered that they are HIV positive. He has also been invited by various local and international HIV/AIDS advocacy groups to share his experience and be a positive example for other people living with HIV/AIDS. He also conducts pre-departure seminars for overseas Filipino workers and advocates the exclusion of mandatory HIV/AIDS testing as a prerequisite for employment. Times have changed a little in Jericho's mind. Filipinos are now more accepting of people that are HIV positive or have AIDS, but this is not the same as saying that people living with HIV/AIDS no longer experience discrimination. Jericho finds it amusing and sad at the same time that a lot of people still think that the HIV virus can be transmitted by kissing or through a mosquito bite or by sitting in the same toilet seat as an HIV positive person. These are all misconceptions, but we still hold on to them. There are now more treatment facilities for people living with HIV/AIDS, but many of our healthcare workers are not psychologically equipped to deal with HIV-positive patients. When a patient is diagnosed as being HIV positive, he or she instantly sees a change in the health worker's behavior or attitude. The health worker treats him or her as a second-class citizen and tries to minimize interaction to the barest minimum. Doctor-patient confidentiality is almost never observed. HIV-positive patients become the subject of hospital gossip and lewd remarks. This is a violation of Republic Act number 8504, or the Philippine AIDS Prevention and Control Act of 1998, which penalizes, among other things, the violation of medical confidentiality. Apart from that, the stigmatization of HIV-positive patients by their doctors or healthcare providers reinforces the patient's already negative opinion of him or herself and makes it more difficult for the patient to come to terms with his or her condition.
Ang HIV kasi is a preventable and manageable disease. Akala ng mga tao na pag may HIV, may tanning na yan. Hindi po gano'n, no? Kasi pwede kaming mabuhay ng 5 years, 6 years, 10 years, 15 years, or 20 years more basta meron kaming positive outlook in life, healthy living, tapos na-monitor namin yung health.
Discrimination against persons living with HIV/AIDS hurts not only the infected persons, it also makes it harder to keep the infection from spreading. Discrimination makes people look away instead of acknowledging the existence of the problem. People who put themselves at risk of being infected because of their lifestyles are afraid to seek guidance on prevention for fear of becoming the object of malicious gossip. People who are already infected and know it hesitate to seek treatment because they know that they will be branded like a leper. The Declaration of Commitment adopted at the United Nations General Assembly Special Section on HIV/AIDS states that, and I quote, "The realization of human rights and fundamental freedoms for all is essential to reduce vulnerability to HIV/AIDS. Respect for the rights of people living with HIV/AIDS drives an effective response." I'd like to challenge you who are in this audience to check the look on your face when you're introduced to a person with HIV/AIDS. If your smile fades away and is replaced by nervous twitching, or if you offer to shake the person's hand anyway because, hey, you're not prejudiced, right? But you try and get to a John as quickly as possible to wash your hands, then Jericho and other advocates like him still have some way to go to alleviate the condition of people living with HIV/AIDS.